Good morning, everybody, and welcome to BARDA Industry Day. It is great to see so many of you here in person, so many familiar faces. I want to start by thanking the incredible BID team that helped put this conference together, the entire BARDA organization for their continued hard work and dedication to public health, and to you, our stakeholders, for being with us over the next couple of days. My key message to you is engage with BARDA and with each other. And make sure these slides work. Great. So you've already heard about the ASPR mission from both Linda and our Assistant Secretary for Preparedness and Response. And essentially, ASPR is responsible for Emergency Support Function 8, which is public health and medical services that result from during a public health emergency from man-made or natural disasters, as well as CBRN events, pandemic influenza, and emerging infectious diseases. And the ASPR mandate keeps expanding, as Dawn has mentioned. And this is because the ASPR organization is a can-do organization within the federal government. Some examples, supporting the infant formula crisis, purchasing and distributing masks and at-home diagnostics during the COVID response. Outside of our typical mission space, but the ASPR organization stood up and did that. And I want to acknowledge and commend the entire ASPR organization for all of their hard work and dedication to public health. BARDA Industry Day, our theme this year, is about driving innovation for preparedness and response. Our mandate is to develop, make available, and license medical countermeasures, which include vaccines, therapeutics, diagnostics, and devices against chemical, biological, radiological, and nuclear threats, pandemic influenza, and emerging infectious diseases. Everything we do, I think, is innovative. We support innovative technologies through our Division of Research, Innovation as Ventures, as well as drives partnerships with our other divisions within BARDA. I believe that our partnership model is innovative, the approach that we take on how the government partners with the private sector to support product development. And you'll hear from all of the divisions today and tomorrow on innovative ways that we are trying to address as many threats as possible under what I call our limited funds. And I appreciate Congressman Hudson's remarks that they are trying to get additional funding for BARDA. BARDA now supports all aspects of product development, early stage development under our CARB-X program, and DRIVE, which encompasses our Blue Knight program, our accelerator network, as well as BARDA Ventures. The meat and heart of what we do, advanced research and development, as well as late-stage product development and procurement. Having visibility across the spectrum of product development allows us to pull innovative technologies forward and support them under advanced research and development, and to address preparedness gaps that we have remaining. And these will become the next wave of MCMs that are hopefully developed. As was mentioned earlier, collectively, we have supported 84 FDA approvals, licensures, and clearances. These products are now available to address CBRN, pandemic influenza, and emerging infectious disease threats, yet we still have substantial gaps to address in preparedness. We appreciate the annual appropriations that are provided by Congress. It's approximately $2 billion per year. $1 billion to support advanced research and development of CBRN medical countermeasures, about $850 million to support late-stage development and procurement of CBRN medical countermeasures, and $330 million to support pandemic influenza preparedness. From what you will hear today, I firmly believe, and I hope that you in Congress firmly believe, that BARDA provides a great value to Congress and return on investment for the funds that we are provided, and we can do more with additional funding, and I am very encouraged by, again, Congressman Hudson's remarks. I also wanted to highlight our COVID-19 supplemental investments, as Linda mentioned, not only in '23, but for the last 3 years. This has been a huge effort on behalf of BARDA, and you can see that we've invested almost $90 billion. This was a joint effort between BARDA and the Department of Defense to award contracts for the development and/or acquisition of vaccines, therapeutics, diagnostics, and also to support industrial-based capacity expansion for sterile injectables. And all of those contracts that were awarded by the Department of Defense with assistance from BARDA have already transitioned to the BARDA organization. This is a heavy lift for us, but we are committed to continuing to support these programs through closeout as vaccines and antivirals transition to the commercial marketplace. And then you'll see on the far right-hand side of the slide, we are very excited about the launching of Project NextGen, which is an initiative between BARDA and NIAID, with investments that initiated in 2023 with more efforts to come in 2024. This single slide highlights many of the accomplishments that we have collectively achieved over fiscal year 23. I just want to mention a few: 722 contracting actions for existing partners, as well as bringing in over 35 new partners to our portfolio, launching of Project NextGen, over 217 tech watches, and in a single fiscal year, the FDA approval of 20 different products, which is an incredible feat, and they are listed on this slide so that you can actually see that these are true products. This is a great accomplishment since these products are now available. However, it also brings up one of my greatest concerns, which is the sustainment of the enterprise. And what I call the enterprise is the partnership between the U.S. government and you, the private sector, to develop these critical medical countermeasures. Neither BARDA nor the SNS has sufficient funding available to meet our established requirements. And I ask you, our stakeholders, as well as Congress, to look at the multi-year budget, especially the out years in that multi-year budget, to see what we have put forward as the true funding that is necessary to sustain this enterprise. Obviously, launching of Project NextGen was critically important. This is the first funding that has been provided in 3 years to support next generation of vaccines and therapeutics. We do not have sufficient funding to do end-to-end product development as well as procurement. Our goal with the available funding is to de-risk the product development for vaccines and therapeutics and invest in technologies under our Enablers program that allow production of those products faster. We are also supporting innovative ways to partner in product development. 2 consortia have been established under BARDA, one for product development and the other for manufacturing. We are streamlining the broad agency announcement to make it simpler for you. We're also expanding the easy broad agency announcement to provide follow-on funding. We are seeking additional contracting authorities under the reauthorization of PAPA that Congressman Hudson mentioned. These were critical authorities that were necessary for the success of Operation Warp Speed. DoD has those authorities, HHS does not have those authorities, and BARDA needs these contracting authorities so that we can better respond to any future public health emergency. The first consortium model that I want to talk about is the Biomanufacturing Preparedness, or BioMAP Consortium. It is critical for the U.S. government to establish partnerships with the commercial manufacturing base to support response. This consortium management firm has been established. We anticipate our first awards are expected in Q2 of 2024, and there will be a consortium industry day where we will highlight the vision for this consortium, and you'll also hear more about it in today's programs. The second one I want to talk about is the Rapid Response Partnership Vehicle, or the RRPV. This is modeled after the Department of Defense MCDC, or the Medical CBRN Defense Consortium, and this was leveraged heavily during Operation Warp Speed. One of my first calls that I made in February of 2020, which seems like a lifetime ago, was to Jason Roos, who was the JPEO of DoD at that time, asking for assistance because I knew this was going to be a really big event, and we needed to pull together everything that BARDA could do along with everything that JPEO could do. We are adding this new platform, leveraging our current other transaction authority and experience with DoD to successfully launch this. And many people will ask, why do you need this? And this is shown on the next slide. Our broad agency announcement and easy broad agency announcement allows for product development, but not procurement. On the other extreme, through request for proposals, we can support late-stage development and procurement of medical countermeasures. And even as hard as we have tried and as much success as we've had in streamlining the RFP process, it is still bureaucratic and can take almost a year. So the RRPV has the opportunity to bridge this gap and allow us to do both, development and procurement under a single vehicle. The two consortium are developed to support the USG need, as importantly is to fit industry's needs. You do not need to join the consortium if you want to partner with BARDA. You can still partner with us through the broad agency announcement, EASY, BAA, or through our RFPs. However, if you want to respond to solicitations that come out under the consortia, you need to join the consortia. It is free to join. It is easy to join, and the management firm that is overseeing these will help you through the process. So I encourage all of you to sign up and join these two consortia. In 2020, we released the BARDA strategic plan that highlights our priorities for the next 5 years with a focus on these 4 goals highlighted on the slide. Importantly, we are not only releasing the strategic plan, but also tracking our progress on implementing programs that support and further these goals. We have numerous efforts underway under preparedness, and I just want to highlight 3. One was already mentioned by Dawn: advancing the pipeline of host-directed therapeutics and ARDS MCMs, advancing tools that can be used in low-resource settings, and investing in host-based and agnostic diagnostics and digital MCMs. Under response, we launched Project NextGen, the Enablers program, which I mentioned briefly. We're also supporting clinical trials for highly pathogenic avian influenza. Everybody is concerned, including the BARDA team, over H5N1 that is currently circulating in birds and mammals, and with a few spillovers of identified human cases, and we want to do those clinical trials to make sure that we are prepared. And we're also advancing new non-clinical models for MCM development. Under partnerships, I've mentioned some of this previously. I do want to highlight on the left-hand side that we have now obligated $250 million under our BARDA Ventures program to establish the Global Health Security Fund, which will invest in innovative technologies. Just one of our funding mechanisms for innovative technologies, as well as what I previously mentioned, launching the 2 consortium models and making our BAA and EASY BAA easier for you as we move forward in partnerships. And then finally, the 4th goal is workforce. We cannot do what we do without people. BARDA has a team of individuals dedicated to public health with deep experience in science, product development, and contracting. We need to continue to attract the brightest individuals to become part of the BARDA team. We are reaching out to universities as well as high schools to tell them about what a career in the U.S. government is like, and encouraging them to choose a career in support of the U.S. government. We're also implementing new fellowship opportunities and interagency exchange programs to bring the best and brightest in the federal government to BARDA. One of the primary goals for BARDA Industry Day is to highlight our priorities for the fiscal year and share those with you, our stakeholders. You'll hear about these throughout the next 2 days as we continue to invest in threat-agnostic medical countermeasures, develop MCMs that address the needs of America's diverse population, as well as spur innovation through reimagining partnerships and opportunities. I want to mention our TechWatch program, which is a best-in-class program for the United States government. We have now expanded this to include other agencies within the USG that fund product development. Through this program, we provide transparent feedback back to you, our stakeholders, the companies on your programs, and I encourage all who may be interested in partnering with BARDA or other USG funding agencies to leverage the TechWatch program. The TechWatch team will work with you and guide you through the process, as well as make sure that the presentation that you provide is impactful for your organization. And so some of the BARDA industry highlights, you've already heard the congressional and administrative perspectives. You'll hear division highlights as well as deep dives on the programs. And most importantly are the networking opportunities. I hope you all enjoy BARDA Industry Day 2023 and remember to engage with us and each other. This is critically important to support the continued success of the enterprise. Thank you.